Hello students, myself Lija ma'am. Welcome back to our community health nursing. We were going through the unit health agencies. So in that we are moving into the end of international health agencies. I hope you all are remembering what all we have studied at. So we have started with WHO. It is a very important question as per you are focusing on your final exam. Then we have studied UNICEF. It is also very important. They used to ask short notes. Any of this they can be asked. So UNICEF we have studied, UNESCO we have studied, then UNDP, UNFPA, then Food and Agricultural Organization FAO, then ILO, World Bank. So many things we have seen. In the last class we have seen regarding the USAID, DANIDA, all these international agencies. Today we are moving into the last three international agencies. So which are they? Rockefeller Foundation, CARE and Red Cross. So these three are non-governmental agencies. Like we can tell these are purely voluntary agencies which is purely guided by autonomous boards. So the first one is Rockefeller Foundation. So it is a non-governmental, as I have told. It's an international voluntary organization. We have already studied few voluntary organizations in the national level in the last class. Not in the last class, in the last unit. But this we are studying in the international health agencies. So this is one of the non-governmental international voluntary agency. It is a philanthropic organization. What do you mean by philanthropic? That is, it is a charitable organization which is started by Mr. John D. Rockefeller in 1913. So its purpose was to promote the well-being of mankind throughout the world. So he was focusing upon the well-being of mankind all over the world. In the initial stages or in the early stages, this foundation was very actively doing services in the areas like public health and medical education. And then later they have expanded their area of interest into life sciences, social sciences, humanities and even agricultural sciences. So they have now they have a wide area of interest for working in order to attain the peace, in order to attain the well-being of mankind. So let us see further the Rockefeller Foundation activities in India. So let us see in India what is the role of Rockefeller Foundation as a voluntary health agency. It started in 1920. In India it has started in 1920 with a scheme for the control of hookworm disease. So they have been focused for control of hookworm disease. Medical and public health programs they were focusing upon. So this foundation really helps, or they really do works associated with medical and public health programs in India. So whatever Indian government is providing in medical and public health programs, so they all give the assistance by this Rockefeller Foundation. The establishment of All India Institute of Hygiene and Public Health in Kolkata was, we can tell, it was one of the main success part by the Rockefeller Foundation. So they have established All India Institute of Hygiene and Public Health in Calcutta. So it was only due to the cooperation of Rockefeller Foundation along with Indian government. They have programs includes the training of competent teachers and research workers. So they have various programs because they aim at well-being of mankind. So for that they all know that education is very important. So this Rockefeller Foundation, they provide a training for competent teachers and research workers. and they give fellowship for abroad education in order to go to abroad, in order to travel, because they will get money for the travel. That means the travel expenses of higher education they used to sponsor. So fellowships for abroad education they provide, the travel grant they provide, and sponsoring of visit by various medical doctors or medical specialists, especially from America. So the highly qualified doctors in the field of medicine from USA, they used to get the sponsorship of visit to India through this particular funding given by Rockefeller Foundation. And they provide fund for medical college libraries also, because we all know that they really want to improve the well-being of mankind. So education or getting educated is one of the main thing for that. So they provide grant for various other institutions in order to develop the libraries of especially medical colleges and population studies, and to assist various research projects and other institutions. Like for example, we can tell that they assist some of the project and institutions like National Institute of Virology in Pune. So in Pune, the National Institute of Virology is financially or technically assisted by Rockefeller Foundation. All India Institute of Medical Science. So the All India Institute of Medical Science, we all know. So even they also get the help of Rockefeller Foundation. As per the foundation is directing its support to the improvement of even agriculture and family planning, rural training centers, and even medical education. So nowadays, see, they have extended, because we have already told, nowadays they are more focusing upon humanities, life sciences, social sciences, and even agricultural sciences. So a part of that, they really look into the improvement of agriculture. They look for the family planning. They look for various services in the rural training centers and medical education. These all are the work done by Rockefeller Foundation in India. So it is well clearly given in textbook. I hope you all are following the textbook. You all have to read the textbook also. So this is about Rockefeller Foundation. So next, let us see about CARE. So it is also an international voluntary organization. So what is the expansion of CARE? Sometimes for 2 marks they used to ask this question: expand CARE. So what is that? Cooperative for assistance and relief everywhere. What is that? Cooperative for assistance and relief everywhere. It was founded by North America. It was founded by North America during the awakeness of the Second World War in the year 1945. It is one of the world's largest non-profit independent international voluntary organization, which stands for relief and development. So they really stand for relief and development. It provides emergency aid and long-term development assistance. So they provide emergency help. So in case of some crisis or in case of some emergency situations, they provide the help, and even long-term development assistance. That means for long-term projects. So let us see what are the things they provide help in India. So CARE in India. So we can see that it began to operate in India in 1950. Till the end of 1980s, the primary objective of CARE India was to provide food for children, especially the age group of 6 to 11 years. Indian services തുടങ്ങിയ കാലത്ത് they really focus upon providing the food for children. So they really mostly used to provide food supply for children, especially under ICDS program. I hope you all know what is ICDS, Integrated Child Developmental Scheme. So you all have studied it in BSc second year. So under this program, and through this program only, all the food supplements are provided even in the Anganwadi, or all the supplements for the antenatal mothers. ഇതെല്ലാം ICDS പ്രൊജക്റ്റ് വഴിയാണ് കിട്ടുന്നത്. നിങ്ങൾക്കറിയില്ലേ, അമൃതം പൊടി, അങ്ങനെ എല്ലാ ന്യൂട്രീഷ്യസ് തിങ്സും, ഈവൻ ഫോർ ഓൾ ദ toddlers, even for the adolescents, even for the antenatal mothers, they all are having supplementary food. It is all provided through ICDS. So along with ICDS, this care agency also help them, focusing especially for the food for children. Then care in India, it works in partnership with the government of India, state governments, and even other NGOs. So really what they provide is they are not alone. They work they work in partnership with the Indian government and along with state governments. Like each of the state governments, they are having tie-up, and even with the help or the cooperation of the other NGOs also. And currently they have so much of projects. So see, like it is helping in the following projects like integrated nutrition and health project. They help, and they help in various even various states also they provide. So like we can see that in the following projects, like for example integrated nutrition and health project, better health and nutrition project, anemia control project, improving women's health project, improving healthcare for adolescent girls, child survival project, improving women's reproductive health and family spacing project, Konkan integrated development project. So these all are some of the current running programs or some of the projects which is helping by care. So you can really you can see that nutrition, health, regarding anemia control, regarding women health, adolescent girl health, reproductive health. So in all these areas, they are really having a big hand or a big support by the care agencies. Not only that, currently it has some of the projects in various states like Andhra Pradesh, Bihar, Madhya Pradesh, Maharashtra, Orissa, Rajasthan, UP and West Bengal. In here all the states, they have even currently running programs also. So you can just see the importance. That's what care was really standing for: emergency help and even for long-term developmental assistance. So these all services or all these projects are really a part of long-term development assistance, because we all know that health is an area where they really need long-term assistance. Then only there will be an improvement in the health sector. So we can see all these areas, they really help. You have to by heart at least few areas so that you will be remembering. Always remember what is care. Care is cooperative for assistance and relief everywhere, founded by North America by 1945. Is one of the biggest international voluntary organization. It provides help for emergency help, aid and for long-term developmental assistance. So in India, care is doing all these various activities. So last one, let us see about the International Red Cross Society. So we all know that Indian Red Cross, like we have heard about Indian Red Cross. So the main part is International Red Cross, and where they have all the countries have their own branches, or they have their own branches in various countries. Even among the countries, they have various junior Red Cross societies, like even focusing upon various states or districts, we can tell. So it is really a growing branch which has so many periphery areas in all over the world. We have already studied in detail about Indian Red Cross in the last unit when we were discussing about the voluntary agency. So the first voluntary agency there we have studied was Indian Red Cross. I hope you all remember that. So let us see something about International Red Cross. So Red Cross is a political, non-official international humanitarian organization devoted to the service of mankind in peace and war. Especially see, not only during the wartime, during the peace time also, they devote the full services for the mankind. As we all know, it is a non-political and non-official. It is a non-political. Sorry, it is written as a political. Red Cross is a non-political. You should read it as non-political. Red Cross is a non-political, non-official international humanitarian organization. It was founded by Henry Dunant. It was founded by Henry Dunant. He was a young Swiss businessman. He was from Swiss businessman who was traveling through North Italy, And what happened, he has been seen various wounded soldiers. So he was so worried about the battles going on in that particular area, and he was very much worried about the wounded soldiers. Though they through that a voluntary national society should be there to take care. So he started the thought, really there is a need for a voluntary national society in order to take care of these wounded soldiers or the wounded people during the wartime. So later he proposed these societies should have a protective emblem and even trained workers. So he want to expand it into another level. So what he has done, he has given a protective emblem. He has designed a particular emblem for it, and even he has trained so much of workers to how to provide care for the wounded soldiers. And finally all his activities met with success. So finally in 1864 the first Geneva Convention took place. Thus this came into being the International Committee for the Indian Red Cross. So the International Committee for the Red Cross has been started by 1864. It has grown into a great mission with various branches all over the world. That's what today nowadays, and today we come to know about the International Red Cross. It was a small history or how it has been started. So if you read the textbook you will be clearly able to understand. So it is only because of one particular person, that is Henry Dunant, who was a very young Swiss businessman who really looked through his passionate eyes towards the wounded soldiers. It made the great success to become an international voluntary health agency, which is known as Red Cross. In 1919 the League of Red Cross Society was created with headquarters in Geneva. So first ഇതെന്താണായിട്ട് തുടങ്ങിയത്, International Committee for Red Cross, ICRC, International Committee for Red Cross ആയിട്ട് 1864 it has become started. And later in 1919 the League of Red Cross Society was created with its headquarters in Geneva. So it was about the history or the beginning of International Red Cross. And let us see what are the roles of a Red Cross. So we all know that all humanitarian services for victims of war. So during the beginning time they were mainly focusing upon all the humanitarian services especially for the victims of war. That was their main focus. And later on they have started with all the other relief services, like which comprises of all the help in natural disaster, prevention of human sufferings, the various services for armed forces, first aid and nursing facilities, health education, maternal and child welfare services. All these things they have been later started with. So never think that it is a society which is standing only for the humanitarian services of war victim. No, later they have extended so much of services even during wartime, and in peacetime they have separate strategies of work. So let us see about the Indian part, Indian Red Cross Society. So നമ്മൾ ഇന്ന് പഠിച്ച ഓരോ കാര്യത്തിലും, even in Rockefeller Foundation we have seen what they do in India. Then in regarding care we have seen, that means cooperative assistance and relief everywhere. We have seen what care they are doing in India. The same way International Red Cross, let us see what they do in India. So in India it is known as Indian Red Cross Society. So it was established in 1920, especially focusing upon three objectives that are the improvement of health, prevention of diseases, and the mitigation of suffering. We all know mitigation of suffering is always a part of their objective. Then in India they really focus upon prevention of diseases and improvement of health, because India is a developing country. So the society provides military hospitals with newspapers, various periodicals, journals, musical instruments and other comfort goods during peacetime. So we have already studied they have different strategies of work during peacetime and wartime. So പീസ് ടൈമുകളിൽ അവരുടെ ആക്ടിവിറ്റീസ് എന്തൊക്കെയാണ്? സോ ഡ്യൂറിങ് പീസ് ടൈം ദ റിയലി ഫോക്കസ് അപ്പോൺ വേരിയസ് പ്രൊവിഷൻ ഓഫ് വേരിയസ് എഡ്യൂക്കേഷണൽ റീഡബിൾസ് ലൈക്ക് ന്യൂസ് പേപ്പേഴ്സ്, പീരിയോഡിക്കൽസ്, ജേർണൽസ് ആൻഡ് musical instruments for relief and comfort, various other comfort goods also in the hospitals. Though they really work for the armed forces or the military hospitals, they really focus upon. It has center for disabled ex-servicemen in Bangalore. Even we have discussed this in the last unit also. They have a big hospital, or they have a big organization in a branch in Bangalore, especially focusing upon disabled ex-service men. During the disaster service, what they do, so this is all what they do during the peace time. So during disaster time, what they really do, so during disaster time they would really focus upon the basic things, that is food, shelter, medicine, all these things. So they distribute milk, they distribute medicine, vitamin tablets supply, cod liver oil supply, all this cod liver oil tablets, everything they provide. Then we have a junior Red Cross, which is one of the most active segment of this particular Indian Red Cross, even in India. It has an opportunity, it gives opportunity to lakhs of boys and girls all over the India, those who really want to be a part of ഇന്ത്യൻ ഡെവലപ്മെൻറ്റ്. ഇന്ത്യയുടെ ഡെവലപ്മെൻറ്റിന് അല്ലെങ്കിൽ ഒരു വില്ലേജ് ഡെവലപ്മെൻറ്റിന് ഒരു പാർട്ടാകണമെന്ന് ആഗ്രഹിക്കുന്ന ഏതൊരു കുട്ടിക്കും ഒരു ഓപ്പർച്യൂണിറ്റി നൽകുന്ന ഒരു പ്ലാറ്റ്ഫോമാണ് ജൂനിയർ റെഡ് ക്രോസ്. സോ ത്രൂ ജൂനിയർ റെഡ് ക്രോസ് many boys and girls are working really in association with various activities like village upliftment, first aid facilities, various epidemics works, for the various developmental classes for the youth, personality development, even the international friendliness, like they have a workshop or seminar with international students, so that cultural exchange will happen, what is happening in their country, what can be improved in our country. All these thoughts are really exchanged in that platform. Their understanding and cooperation, so which will really lead for the development. So this is all done by the junior Red Cross. So as I have told, Indian Red Cross, they have two type of set of activities during peace time, what they do, and during the disaster time, what they really do. This is all about the Indian Red Cross. I hope you all have understood what we have studied today. So today we have seen only three things: Rockefeller Foundation, CARE, which is known as Cooperative and Assistance and Relief Everywhere. Then we have seen Indian Red Cross, which is a part of International Red Cross. That's why we are studying it under International Health Agency, because it is known as International Red Cross, and Indian Red Cross and Junior Red Cross is a part of that. So here we are finishing the various things which is given in your syllabus, but still you don't think that only whatever is given in your syllabus are the international health agencies. We have plenty of health agencies, not only international, we have even national also. Like all these things, so many, we have plenty of organizations. So here I have listed down some of the non-governmental organizations. They are Save the Child Fund, International Planned Parenthood Federation, the Population Council, Voluntary Health Association of India, All India Women's Conference, Indian Medical Association, Trained Nurses, TNAI, Trained Nurses Association of India, IMA, that is Indian Medical Association, World Federation of the Deaf, World Federation of Medical Education, National Union Against Cancer. See, these all are various non-governmental organizations. It will be improving your general knowledge if you have a broad knowledge about all these things, because don't think it as a part of your community syllabus or your community. You are going to be a health personnel, you are going to be a staff by next year. So during that time you should have a thorough knowledge about various health agencies, especially international agencies and the national health agencies. So I hope through this unit you have understood about various international and national health agencies. So in the coming class we will summarize this particular unit. During that time you all should read the whole textbook of this particular unit, health agencies, and we will have a summary class in the coming day. Thank you, students.